The underlying root causes of most chronic diseases, including cardiovascular disease, it's driven by inflammation and oxidative stress, and we have to understand what causes those things. And largely what causes most inflammation and oxidative stress in our body are environmental toxins, metals, pesticides, herbicides, PFASs, PFOSs, otherwise known as forever chemical, plastics. It's not, a question anymore, because once you start to order environmental toxin testing, and I order environmental toxin tests on every patient that comes through my door now. And over the course of the last 3 years, it's been appalling to me how people with Parkinson's disease and people with all these autoimmune conditions and cancer, they're driven by exposure to environmental toxins.
Well, welcome to Biohacking with Brittany, the podcast where science meets wisdom. I'm Brittany Ford, holistic nutritionist, biohacker, and mom. And for years, I struggled with gut issues, hormonal imbalances, and the exhaustion of motherhood while running a business. Biohacking and functional medicine became my way back to clarity, vitality, and trust in my body. And that's why I'm here, not just to share information, but to share the practices and perspectives that truly shifted my health and my life. Each week, I bring you science-backed tools, honest conversations, and rituals I live myself so you can return to your own body's wisdom and create longevity on your own terms. Because your body already knows this is just the space to remember. Welcome back to the show. I am thrilled that you are listening to today's episode. We are diving into everything toxic in this episode, all of the toxins that we're exposed to, how to kind of lead a non-toxic life, how to test for toxins, and the surprising thing that you can actually do before doing your test that will actually dramatically change your results. This is something I've never heard, and this is something brand new to me, and it's really, really made me rethink kind of some of my practices and my detoxing practices as well. And joining me on this episode is Dr. Christopher Davis, who is the chief cardiologist at Human and is a founder and CEO at Reveal Vitality. He is a triple board certified doctor in internal medicine, cardiology, and interventional cardiology, and a specialist in functional medicine. And that was really cool. We actually got to dive into functional health, where he studied what he recommends as well, and kind of the view on how functional medicine can really layer on top of his experience as a cardiologist and how he applies that to his patients. He has been honored as one of America's top doctors, and we really just got to sit down and talk all about what he's seen in his practice today, what we can do in terms of aging and longevity as well, and all of those types of things. We also touch on nitric oxide in terms of its role in cardiovascular health, what he sees in women versus men. There's a lot of really interesting things we talk about in this episode, and it was such an honor to have him on the show. He is very well-versed in this space, and I really did learn a lot from this episode. Before we dive in, a shout out to Bioptimizers. I posted a story about their digestive enzymes and it blew up. And honestly, for good reason. Their enzymes are phenomenal. Okay. I take them with every meal, and they actually help you absorb more of your protein. So if you're going to eat a chicken and it has 25, 30 grams of protein, if you take digestive enzymes with it that are filled with the appropriate protein enzymes that match up some of the protein and amino acids that are in that chicken, it can actually help you absorb more of that chicken, which is awesome. So it's not necessarily that you need to eat more protein. It's actually that you need to absorb more of it. And then we also have the things that it can help with as well, like gluten or lactose or soy, these other triggers that a lot of people have that are kind of everywhere in our food now. You can take enzymes and really just help digest them so you have less of an inflammatory response when you eat those foods. So I take digestive enzymes with really large meals, with anything that is somewhat inflammatory or eating outside of like my typical food that I eat. So like yesterday we were celebrating my mom and we had carrot cake, and it was like full on carrot cake, full of sugar, full of dairy, full of everything. And so I took 5 digestive enzymes with that just to kind of mitigate the response that would come from something like that. So, really great to have on hand. I keep a bottle in my car, in my pantry, everywhere I go, and really help to reduce the symptoms as well, like bloating, feeling just like really lethargic and tired after a big meal, or skin issues, or gas, or indigestion, anything like that. Digestive enzymes are a fantastic way to start. That's by Bioptimizers. I will link it in the show notes and on my website. You can use my discount code BiohackingBrittany and it will save you as well. So enjoy this podcast episode. Thank you for tuning in. And a shout out to my retreat. I just want to plug my retreat before we start, called Optimize Her. It's a women's wellness biohacking longevity retreat. And I'm so excited for it. And it just actually got featured in its first press outlet, which is really cool. It's been featured in the Raven Reports. I will link that in the show notes as well. They did an article on it, which was so cool. I just found this out a couple hours ago, and they're featuring it. And they wrote an article and they said it's called "The Rise of Women's Biohacking Retreats: Why Longevity Travel is Shifting Towards Women." So cool. I'm just honored to be featured. Thank you, the Raven Reports, for featuring me. This is great. And I'm so excited to see where this goes. If you're feeling called to meet me in Costa Rica next March 2nd to 7th, my goodness, I would love to have you in Costa Rica. We still have some spots left. I've actually just opened for alignment calls. So if you want to hop on a call and just hear about it and see if it's a good fit, I'm doing that. I've opened my calendar up. I would love to have you join us and be one of the women who are going to be in that incredible circle. So thank you guys so much. Enjoy this podcast episode, and I will catch you soon for another one. Dr. Christopher Davis, welcome to the show. Before this, we were talking about, honestly, functional medicine certifications and your recommendations. And as somebody who is as educated as you are, I'm kind of curious, what made you focus on cardiovascular health and even like this idea of nitric oxide and its role in our health in general?
Well, as focusing on cardiovascular health is kind of easy. So I'm a cardiologist by training, and so why cardiovascular health? I always like to say in a previous life, I am an interventional cardiologist by training, and
Hmm.
interventional cardiologists are the cardiologists who run in the middle of the night and open up arteries and put stents in, and when people are having a heart attack. And I did that for about 10 years. And that was very exciting. And to answer your question about why cardiovascular health, I'm always an instant gratification type of guy. And in doing my internal medicine training and looking at different specialties, cardiology was very intriguing because of the fact that it had that instant gratification component, particularly with interventional cardiology. Somebody's dying, having a heart attack. You go in, we put a wire down and a balloon in, and we open up the artery, and all of a sudden we've saved their life, right? That was kind of what drew me to it. I love the excitement. And I also love, I mean, the fact that cardiovascular disease is the number one killer and has been for eternity, I felt like I had a lot to offer people. And how I continue this kind of in the functional medicine space, obviously after practicing for 10 years, I realized that putting those stents in never addressed the underlying root cause of why that person had that heart attack in the first place. And so, after 10 years of practicing medicine and prescribing medications and statins and beta blockers and realizing that, okay, they may have some benefit, but they are not the solution to the problem. I started to look for other reasons and other, how do we address what's really truly driving this? And that led me to the whole world of functional medicine. And I didn't know anything about functional medicine, but truly all functional medicine is it's taking us back to our first couple of years of medical school and utilizing all of these pathways and biochemistry that we learned on, why people have disease processes. And instead of prescribing medications, actually using what we know about the underlying root cause and addressing those causes. So that's what led me to kind of doing cardiovascular health in the functional medicine space. And that's kind of led on to all lots of other stuff in the longevity world and health optimization space, I would like to say now. And you
Hmm.
can't optimize your health without optimizing your cardiovascular health. I always like to say, at the end of the day, you can do all this other stuff, but if we don't focus on cardiovascular health, then you have no health.
Yeah. Yeah, I love that. And in your practice and experience, what do you think some of those root causes are that you see or that you've even studied and been like, "Okay, this is what's coming up?"
Oh wow, this is a really exciting question for me, and it's very easy. Okay, and I'm pretty sure I'm right about this. Okay, the reason the underlying root causes of most chronic diseases, including cardiovascular disease, it's driven by inflammation and oxidative stress, and we have to understand what causes those things. And largely, what causes most inflammation and oxidative stress in our body are environmental toxins, metals, pesticides, herbicides, PFOS, PFOA, PFASs, PFOSs, um, otherwise known as forever chemicals, plastics. And this is not, it's not, a question anymore because once you start to order environmental toxin testing, and I order environmental toxin tests on every patient that comes through my door now. And over the course of the last 3 years, it's been appalling to me how people with Parkinson's disease and people with all these autoimmune conditions and cancer, they're driven by exposure to environmental toxins. And when you remove these toxins, whatever modalities you use, the patients get better. People who are
Hmm.
debilitated, they can't get out of bed. Okay. That we remove these toxins, the oxidative stress gets better. Their mitochondrial function gets better, right? Mitochondria that produce the ATP, our energy of life. We don't have those mitochondria now all jammed up with all these toxins, and they get better. And so
Right.
I don't think that's not a hard question when we talk about cardiovascular disease, but it's not just cardiovascular disease. It's all these metabolic conditions like diabetes. It's the neurocognitive diseases. It's cancer. It's all of them. And, if you come, I mean, I have presentation after presentation that I will show you. We can just show you the data and it's there. So hopefully as a society, if we start to do these tests more often, we will answer
Mm.
a lot more questions about why people are sick.
Yeah. Yeah, absolutely. Is that test something that people have to do through a practitioner, or can they order it themselves?
I don't think the test that I use is through a company called Vibrant Wellness.
Mhm.
Vibrant has a test. It's a Vibrant Total Toxin test. And that Total Tox test from Vibrant has mycotoxins. It has all of the environmental toxins that I mentioned the metals, plastics, pesticides, herbicides. It even the PFASs that we talked about. So it's a pretty broad spectrum of toxins. Probably the broadest spectrum toxin test that I know that's out there. And as far as I don't know if you can go to so a few of their tests you can actually just order yourself. You might be able to go to Vibrant's website and just order that test without a practitioner.
Hmm.
Um, but I actually have on my website actually just a place where you can go and order that test too. And I have my health coaches actually review those with clients because I think it's so important. I think environmental toxin test is so important, and many people haven't had it done that you're missing the forest for the trees about what's truly causing a lot of people to have these illnesses.
Wow. Yeah. I mean, I haven't even done one, to be
Yeah,
honest.
yeah. I mean, we will go. I mean,
Yeah.
it really is. It's imperative that you do that. And I'll tell you, all of us have toxins. Okay. All of us have some sort. I mean, in today's modern life, you're going to be exposed to toxins.
Mhm.
Now, to what extent you're exposed to them is going to be different. And to what extent your body can detoxify what you're exposed to is going to vary, right? It's
Right.
going to vary based on your microbiome. It's going to vary based on your genetics. It's going to vary based on your micronutrient status that are all cofactors for detoxification. So there are many factors that go into how toxic you're going to be. But if you don't know what you're exposed to, then you don't even know, one, if I'm being continuously exposed, I daggone sure want to know about it, right? So I
Mhm.
can address that ongoing exposure.
Have you ever eaten a meal that was supposed to be nourishing, but instead left you feeling bloated, heavy, or just off? That's where I was until I started using mass enzymes by Bioptimizers. Here's the truth. After age 30, your body naturally produces fewer digestive enzymes. That means even healthy meals aren't broken down as well, which can leave you dealing with gas, bloating, or nutrient gaps. Mass enzymes is a full spectrum digestive enzyme blend designed to help your body break down proteins, carbs, and fats more effectively so you can absorb more of the nutrients you're actually eating. And guys, honestly, I personally noticed smoother digestion, less post meal heaviness, which I love, and more energy after meals instead of feeling sluggish. I know we've all been there, and there's so much room to grow and so much we can actually do about that. If you've been struggling with digestion or you just want better support in this space and even with your gut health, I highly, highly recommend Mass Enzymes. And because I want you to feel the difference for yourself, Bioptimizers is giving my listeners an exclusive discount. Just go to bioptimizers.com/biohackingbrittany and use my code biohackingbrittany, and it will save you 15%. That's 15% off of Mass Enzymes and actually all of their products. So that's bioptimizers.com/biohackingbrittany. Use my code biohackingbrittany and your gut will thank you. Yeah, that's actually so interesting. I've had my microbiome done, my nutrients done, my genetics done, and I have all that data, but I don't have the data of like actually looking at the different toxin levels that I'm dealing with on a day-to-day basis.
Yeah, super important. I mean, I tell everybody, and then what I would
Mhm.
recommend if you decide to do this test, what I'll tell you, and a little nugget for anybody else that decides to do this test, I would recommend that you do an infrared sauna on the day prior. Okay, and then it's basically a urine test. It's a first morning void. Do a sauna on the day prior and then do the first morning board the next day. Okay. And the results of using a sauna prior versus not using that sauna, they are entirely different. And so I was using this test, the heavy metals part of this test, 2 years prior to listening to a lecture on using the sauna prior. And I was always thinking to myself, well, that 2 years, like this test will come back normal in 90% of the people, like normal. And I'm like, man, it can't be normal. And I was about to switch to a different company. And then I watched the lecture, some series I was watching. They said, hey, we should always use the sauna prior and then do the test. I started doing that over about 1 week. And literally, the difference I saw was incredible. So I haven't looked back since then. I haven't looked back since then. And when you do that, and it's not like if it's there, it's there, right? And so
Right.
that changed my whole practice. My practice now, I would say probably at least 70% of my business revolves around environmental toxin right now.
Wow.
And when you and it only started when I started doing the sauna prior. So having said that, how do we deal with these toxins, knowing that we are continuously exposed to them and we're going to be continuously exposed to them in our
Hmm.
body, no matter how good we try to be, right? No matter how much plastic that I throw out of my life, no matter how much I try to avoid
Yeah.
the insecticides and pesticides, we're going to be exposed to them, right? So the
Yeah.
infrared sauna is incredibly important. Infrared sauna, or even just a sauna in general, I like infrared saunas. I will tell the number one biohack, and there are lots. I have a longevity center with every biohack you can imagine: hyperbaric chamber,
Oh,
light bed, cryo, molecular hydrogen. I have everything, right? But the number one tool for health and biohacking is the infrared sauna because that's what's driving a lot of the chronic illness.
wow. Okay, wait. So I just want to go back to this. So you do the sauna and the infrared sauna, and then you do the test the next morning.
Uh-huh. Yes,
And it's a urine test, is what you
urine
said.
test. Just collect
Right.
your first morning void. Collect
And
your
so,
urine.
and so the sauna, the heat from the sauna is detoxing you and it's helping the toxins come out
Yeah.
further in your urine.
So you mobilize those toxins from those typical storage sites like fat,
Yeah.
okay, protein, okay. Those are the typical storage sites for the toxins. And then obviously it gets mobilized and then it gets back into the bloodstream, goes to the liver. The liver conjugates, does all this metabolism thing, and then into the bile and into the stool, and then into the urine as well as it's filtered through the kidneys. So when you mobilize it, right, we picking up what happens is if it's stored in your fat cells, you're not necessarily going to see it if you just do the urine test by itself. And that's what I found in practice. So now when you add, it's almost like, back, and some people still do this. A lot of people do provoked environmental toxin tests or provoked metal testing, DMPS, DMSA. And that kind of came to a lot of kind of scrutiny about using these provoking agents and then looking at the results and people saying, well, how do we compare? How do we know what normal is after you've given a provocative agent? And so a lot of people would say, no, you can't do that. We don't. Well, one way to get around that whole thing is just do a sauna because at the end of the day, doing a sauna is like, I just say you go to a sauna tomorrow, where I can do, and all of a sudden I got all these toxins. And so it's not something, a medication that I'm giving you to provoke. You just did a
Yeah.
sauna, right?
Yeah. So
So
I, yeah, I hear what you're saying. I have a traditional sauna at my house, and it's wonderful, and it's outside, and, like, you can add water to it, and I use it probably, like, 4 or 5 times a week.
Yeah, I think
What
that's fine. I don't think it has to be infrared, okay? I
Okay.
think you could traditional sauna as well. In fact, you using that sauna 3 to 4 times a week is fantastic, and your toxin burden is probably well controlled, so that's great. But I
Yeah.
still would toxin touch, yes.
Yeah, yeah. You might not know the answer to this, but, I have a kid, I have a baby, and I'm still breastfeeding, and I didn't really sauna when I was pregnant. My heart rate was already really high, I couldn't really handle the heat, but I do sauna breastfeeding. Do you think that's bad? What do you think? My kid is 13 months, he's super healthy, I don't know.
I would get the toxin test to answer that question. Um,
Okay.
oh, no question about it. You are mobilizing these toxins, but we don't know what you're mobilizing. Maybe you've been doing the sauna so long prior that you don't have a lot of toxins that are there. But certainly, if you are doing a sauna and then breastfeeding, you are likely giving some big loads of toxins that you may have. We just don't know what you have. So I
Mm,
think I would be careful, particularly, and we can maybe just about the timing of it. Like, don't sauna for, I guess the part though, you're breastfeeding like every day. So how do you?
yeah,
Because those toxins, when you sauna, they're going to be in the system at least. I mean, I don't know like the half life exactly, but
yeah,
it's going to be at least hours, minimum 8, 10, 12 hours at it, maybe higher levels. So I'm not sure how you would
mhm,
actually continue to sauna. So it's a very good question. I think that I would definitely do my toxin tests to help decide that. If you don't have many toxins, hey, go for it. If you got lots of toxins
yeah,
picking up, I probably would be a little careful. I mean, there's a study was just published recently about the number of toxins that are found in newborns. And I can't remember the number, but there was a publication literally about a month ago. We do plasmapheresis at my facility as well, and so we do a lot of environmental toxin tests. And the founder of the company sent me this article on newborns and the number of toxins we're detecting in newborns continues to increase. So I would get your own toxin testing done to see what you are potentially exposing your child to.
yeah, yeah, that's a really good idea. I mean, I've been breastfeeding for 13 months. So, and I've been using the sauna quite a bit. So he's definitely been exposed. Like
Yeah.
there's no way he hasn't. But I think it's a good question of like what was my load even going into it? Um, I did sauna a lot before pregnancy, but pregnancy's 9 months. And what do you think in terms of accumulation of toxins? If you were to take a break from exercising and all the ways that we detox for 9 months, like how much can you accumulate in that time? Or is it specific based on what you're exposed to?
Yes, what you're exposed to and the things we just talked about, right? What we're
Yeah.
exposed to, what your detox capacity is, what's your glutathione genetics, what's your methylation genetics, right? There's a lot of factors that play into, could be exposed to the exact same amount of a toxin, but how much of it is going to be actually a body burden we're going to stay in our body? It depends on our detox pathways, but that's why it's important to make sure we are optimizing the detox pathways always, making sure that we have the cofactors, the nutrients for methylation to occur, all of the factors for glutathione to be recycled and to be made. That I can't. There's not a one size fits all answer, but it's
Mhm.
also important. That's why we talk about our lifestyle is so important, right? What we're putting in our body, eating organic food, making sure we have some type of water filtration system on our home, making sure that we're not having, storing or cooking in plasticware, making sure that you're not cooking on cookware that has all of these PFASs on it.
Mhm.
Um, there's just so many places where we can get these toxins. It's just about minimizing that toxic load and optimizing detox pathways.
Yeah. So I've done everything that you've said. And I have a feeling a lot of my listeners have too. Like we've swapped out the pans, we're not doing the plastic. Um, my prenatals and postnatals have all been methylated. My pathways are mediocre. Like I'm not super great, but I'm not also terrible in terms of my detox pathways and my genetics related to it. Um, I have taken glutathione as well and like these different supplements that also like help build glutathione and that type of thing. So I feel like I'm kind of like attacking the problem from different areas.
Right.
But there's just I also just feel like there's so much out of my control even that like I just think about even the air that I breathe or like when I'm stopped at a traffic light and I roll down my window.
Mhm, mhm.
And I don't live in a city. I live in a small town.
Yeah, I think that that's where and this is what I always tell my patients is, I mean, that type of mentality, what you're feeling is, we just have to realize we can't control everything, and that's why the detox pathways, that's why the sauna. I mean, honestly, I should be a sauna salesman right now because of the simple fact that we know that there's stuff out there, right? And I'll tell you this. This is true. This is true story. In the probably 1,000 or so environmental toxin tests that I've done, everybody has something. I have 3 patients that have had I mean, essentially clean toxin tests. Everything was in the green. And of those 3, well, not I mean, all 3 of them, all
Mhm.
3 of the people who were using the sauna 4 to 5 days a week, and they have been doing so for a year, 2, 3. And that was the wake-up call for me that, man, this sauna thing is really real, okay?
Yeah.
And not to mention the fact that the whole testing thing that I did, you do the sauna, and then we can detect all these toxins. Well, that means I mobilize it. That means the sauna did something. That combination of things for me showed me 100% that these saunas are amazing tools for keeping these toxins out of our body.
Yeah. Yeah, absolutely. Yeah, which is why we got one and invested in it. Um, and a sauna has been like one of my favorite biohacks for years. Not necessarily actually from the detox pathway thinking and everything that it does, but more so because I feel so good
Good. Yeah.
during
Yeah.
and after that
Yeah.
like it's really hard for me to find that level of like almost like peace and happiness.
Yeah.
Because when you work out, right, it's more adrenaline and it's much more like go, go, go. But the sauna, I come out, I'm like a better person. So,
Yeah. Let's talk about that for a second, because this is a great segue into something you asked me about before about,
mhm,
nitric oxide, things like that. But let's talk about
yeah,
the sauna is not just about detoxification. That
yeah.
sauna is doing a lot more than that, right? The sauna is actually increasing and mobilizing stem cells, right? The sauna is increasing nitric oxide release. The sauna is increasing mitochondrial biogenesis, producing more mitochondria, making your mitochondria more efficient, right? So there's so many part of that feel good factor is not that, hey, I just sweated out, a bunch of lead. That's not it at all. It's all those other factors that we just talked about that where the benefits come in. Not to mention, if you have a full spectrum sauna, you got all the skin benefits as well, right? That come with it. If you have joint aches and pains, there's improvement in inflammation of joints that sometimes there's pain relief. So there are lots of other benefits of the sauna. The actual detoxification part of it is just one of those things.
This episode is brought to you by Optimize Her, my women's biohacking retreat in Costa Rica, happening March 2nd to 7th, 2026. I am so excited, guys. This isn't just another yoga retreat. It's a 5-night, 6-day, science backed health optimization woven into feminine restoration, designed specifically for women's bodies. We'll dive into functional medicine and longevity tools, experience healing sessions like sound baths and cacao ceremonies, and recalibrate with daily movement, spa rituals, and farm to table meals that support hormones, gut health, and vitality. It's not about fixing, it's about clearing the noise so you can actually tune into your body again. If you're ready for deep restoration and transformation, you can explore all the details in the show notes. And I would absolutely love to see you in Costa Rica. Yeah. Yeah. What does your sauna practice look like for you and your family?
For me, it's 7 days a week when I'm at home. I
Wow.
sauna 7 days a week, and it's only because and honestly, I did my own toxin panel. I mean, I had
Nice.
all kinds of mycotoxins and, nitrosamines and all kinds of things, right? And so you think and I mean, we try like I said, we try to do the best you can, but at the end of the day, you're gonna be exposed to these toxins. And so, the sauna for me was, I mean, and I feel great about it too, but I see my own environmental toxin panel. So, and when we talk about biohacking and longevity and my overall health optimization performance, Sauna's at the top of the list. So 7 days a week. If I'm in Sarasota, Florida, I'm saunaing 7 days a week. Unless my wife tries to have me take the kids to school at 6:20, like she did the other day, and I still came into my office and sauna.
Um, do your kids sauna at all?
I don't have them sauna right now. Well, actually, occasionally, not regularly. I have a 12-year-old and a 15-year-old. One, they don't do it because they don't listen to dad. Okay, this is my kid now. Okay, these are my kids' responses to me. Oh, I guess that's going to cause cancer too. Because everything I try to teach them, oh, I
Yeah.
guess that's gonna cause cancer too. So they don't really listen to dad, unfortunately, about the things they need to do for their
Mm.
performance. I try my daughter, one of my daughters is she's a rower and a pretty elite rower. And I'm watching what all these kids are eating and stuff like this. And the things you can get away with when you're 15 and they just continue to do it instead of what they should be doing. And it just kind of just goes, hopefully one day she'll start to listen.
Yeah. Yeah. Oh, she'll swing back around for sure. Sure.
Yeah.
It might just take until she's like, 25 or something like that, but,
Yeah. Yeah.
it'll happen.
I'm open.
Yeah, yeah. Um, my friend was here visiting last night, and her dad just had a heart attack, actually, and he's in his 60s, and they put 3 stents in,
Mhm.
and she was talking to me. They put him on medication afterwards now. She was talking to me, and she was saying that she wonders how this would affect her and her health, and genetically, if there's anything that she might be more predisposed to because of his genetics and that type of thing. Um, is there any truth to that? If our parents have heart issues and cardiovascular issues, will we have it? And does it matter gender wise at all there?
Yeah. I certainly think that there are genes. So first of all, your genes are not your destiny.
Yeah.
And right, I know that our lifestyle really is important in how those genes are expressed. Having said that, there are genes that certainly put you at a higher predisposition to have coronary artery disease. And so if her dad, 60 is kind of, I would call that that's not super young for having heart disease, but still young enough that I would be looking at some of those genetic risk factors. And one in particular that everybody should know about because it is the real deal with respect to genetic causes of heart disease. There is a gene for a molecule called lipoprotein little a, LP little a. Okay. And LP little a is a marker that if you have high LP little a levels, that's the marker that you hear stories about. Hey, my dad had a heart attack at the age of 47. His brother had a heart attack at the age of, 52, and his sister had a heart attack at the age of, 51. Those are those people who really have early heart disease when you have lipoprotein little a gene variant. So it's on an advanced lipid panel. Not many people have had that test done, but I would encourage everybody from a risk stratification perspective
Yeah.
to have that test done. And if it's high, really think seriously about other modalities that you could use to assess your the risk of heart disease. And we can talk about that in a little bit about kind of what other modalities in assessing heart disease and what we should be looking for. And so as far as, increased risk genetically male versus female, I don't know that I can think of whether having a gene variant, for example, of the LP little a gene variant or any of the other ones that are associated with heart disease, ApoE. I don't know that there's any difference in the male female if you have a variant of that of those genes. But certainly, again, for her for with her father had it, she should have an advanced lipid panel with an LP little a done just to kind of assess biomarker wise where her
Yeah.
risk is. Okay, so I would definitely look at that. And then for her father, I would say this many times when somebody's had a heart attack, you really need to look at that underlying root cause and you need to think about this person has vascular disease, vascular inflammation. Heart disease is an inflammatory disease that is also driven by oxidative stress. Inflammation drives oxidative stress, and oxidative stress drives inflammation. All right. And so there's vascular injury there, and putting a stent in doesn't deal with the vascular injury and it deals with just where that blockage was, but the entire vessel is likely damaged. So really paying attention to what's causing vascular injury, i.e., what we just talked about with all the toxins, but how do we repair that vascular injury? You're like, what does the inside of that vessel has a layer called the
Yeah.
endothelial lining, right? And something that's actually kind of come up over the last 5 to 7 years, and maybe a little bit longer than that. I think I've kind of known about it for the last kind of 5, 7 years, is the layer that sits on top of the endothelium is called the glycocalyx. And that glycocalyx is a slippery mesh-like network of polysaccharides that keeps everything nice and slippery running
Mm.
as the blood passes through our arteries. I like to use the analogy of a fish that has the mucousy layer on the scales, right? That mucousy
Yeah.
layer is very slick. Well, inside of our artery, this layer, this glycocalyx layer, causes this kind of slippery layer inside, such that all the red blood cells and our cholesterol and platelets, nothing kind of sticks to the vessel wall. But as that glycocalyx is kind of worn away, right? It is damaged from whatever it is. If it's, heavy metals, if it's viruses, one of the, where we really started to learn about this is with COVID and spike protein damaging the glycocalyx and then damaging the endothelium. One of the main reasons that we have so much of this clotting issue with COVID is that it's damaged the endothelium, it's damaged the glycocalyx, and all of a sudden now we got platelets sticking to that endothelium, that inner lining, and clots forming. Okay, if we could reline that, if we can reline that inner layer, then couple things happen. One, he's much less likely to have another event, and progression of disease is much less likely to happen because now we're kind of healing that endothelial layer and the top layer called the glycocalyx. So, and there are products out there to help do that, natural products that are seaweed based products that actually help to reline that vessel. Okay.
Wow.
And one of the company that I'm the chief cardiologist, human, has a fantastic product called Calyx.
Mhm.
Glycolytics is by far my favorite cardiovascular product. And I say that because it actually has the seaweed to help reline the glyco or remake the glycocalyx, but it has a combination of other things in it. Aged garlic, grapeseed extract, which are great for releasing more nitric oxide. They're great for blood pressure control or helping maintain adequate blood pressure control. Aged garlic can be used to lower cholesterol levels, although we'll talk about later, chasing cholesterol numbers. We'll talk about that a little bit later,
Yeah.
probably. But it helped to promote a more favorable cholesterol panel or numbers, should I say. And then lastly, it has something, a superoxide dismutase in there. And superoxide is a oxidative stress or reactive oxygen species that causes damage. It causes this oxidative stress. And I always like to say this too, because most people will say, if I were to ask you, I'm gonna do this, I'm gonna put you on the spot.
Okay.
What is oxidative stress?
The accumulation of stress in the body. I wouldn't necessarily know how to explain the the
But
science
but
chemical
but
reaction.
but that's kind of my point is just that though, even as a cardiologist, about 3 years ago, I asked myself, somebody asked me, what is oxidative stress? Well, it's uh
Living in my
yeah,
textbook from science
right.
class.
So, so I think the easy way to explain it is,
Mhm.
so I like to think about oxidative stress. If you think about 100-year-old house and it has these metal pipes, the water pipes that brings the water to the house, those
Mhm.
pipes slowly develop. And I have in a couple of my presentations, I show a pipe, and that pipe just develops rust inside, right? A layer upon layer of this orange rusty stuff, right? That orange rusty stuff is all oxidative stress. That's all oxidation that goes on, oxidation of that metal pipe.
Right.
Right?
Right.
So if you think about oxidative stress as just being rusty, think about when I tell my patients now, hey, if you've got oxidative stress, you're getting rusty inside. My body's getting rusty inside. Why do we get old?
Ah,
Oxidative stress is the major reason we get old. Why do we get old? Because we're getting rusty inside. We're developing rust that builds up inside our body, right? And so we're trying to, if we think about, we know that
mhm.
the good things in our antioxidants are great, right? Whatever, vitamin E, vitamin A, vitamin C, alpha lipoic acid. I mean, all of these glutathione are antioxidants. Why are they so good? They're
Yeah.
good because they're the rust busters, right? They are the rust busters. So if you think about it that way, when we talk about oxidative stress, you have some kind of concept of what we're talking about. When I keep saying, this causes oxidative stress, and we'll probably get into these conversations about mitochondria, and mitochondria are actually being somewhat responsible for oxidative stress. Although we think about mitochondria as being good, they also are the biggest producers of reactive oxygen species that cause oxidative stress.
Mm,
So anyways, yeah, so dealing with the oxidative stress, the superoxide dismutase kind of deals with one of the major molecules called superoxide that causes this rust.
nice. I actually love that analogy. I'm going to use that because it's very easy to understand, like actually from that standpoint. And then yeah, how do we like shine up or like get rid of the
Mhm.
rust? Essentially, is what you're saying. What's interesting, what my friend also said that I was thinking about while you're speaking is, her dad is a smoker. And her words were, "I thought it would be something with his lungs, so I was surprised he had a heart attack." And I didn't say anything, but I was in my head, I'm like, it doesn't always work like that in the body. It's systemic inflammation. It's not going to necessarily show up where the one place is that you're bringing in all the toxins.
Yeah, 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 yeah. And okay, one of the largest, so very commonly, that people who smoke have heart disease, and they have it largely because of a heavy metal called cadmium.
Mhm.
Cadmium is in tobacco in a major, major way. Cadmium is directly vascular toxic to the vessel. So that same endothelial lining that I said was damaged, right?
Yeah.
Cadmium is a major part to that. So if we were to do, I mean, I can always tell the people who smoked. I mean, when I do environmental toxin tests, people who smoked and smoked and smoked, cadmium is always high, right? And so it's not just the damage to the lung from inhaling. We're actually causing endothelial damage from and it's not just in the vascular space in the heart. We're talking about vessels all throughout the whole body. We're talking about the kidney. So smoking does a lot more, and who knows what other toxins, right? That are in, we know cadmium is just one of the molecules that we see a lot, one of the metals we see a lot. I can assure you that a lot of the pesticides and herbicides are also in these tobacco products, but we don't know those things because nobody's ordered tons and tons of environmental toxin tests in the past. My hope is that we can get environmental toxin tests to be at this. I mean, really, that needs to be at the start of an evaluation of any person who's sick, in my opinion, right now.
Yeah. I love that. Um, I don't know if you're gonna know the answer to this, but what are your thoughts on chewing tobacco in terms of cadmium levels? My husband does it every now and it kills me inside, but I'm, like, letting him do his thing, and he doesn't smoke, and but he does cigars. So, like, do you know anything about cigars and chewing tobacco?
I don't know what the absorption is, but here's the key. Just have him do a test, right? Do an
Yeah,
environmental toxin test, right?
yeah,
Because
yeah.
at the end of the day, you guys can argue till you blue in the face about what's right or wrong,
Mhm.
and what's going to answer the question. If I don't have a lot of toxins that potentially came from and which I guess the only remaining question would be is what you find, could it have come from the cigars? Did it come from his, chewing tobacco? But there will be some things that might just kind of light up and be like, yeah, that's probably from that. And you'll be able to say, for example, the pesticides and herbicides, that's probably chewing tobacco. Cadmium, that's probably chewing tobacco. So I would just kind of look at, I mean, I would do a test and kind of see what's there. Now, if everything looks great, okay, there are probably some other things you would have to worry about, but he could make the argument, "Hey, my toxin panel looks better than yours, so let me chew this tobacco."
Yeah. Yeah, honestly, like, he saunas all the time, right? And, like, he's pretty healthy, you know? So,
Yeah.
that's why I kinda just, like, you can't control and you can't, like, get them to do everything. He's not a biohacker, okay? He's, like, exposed to me and that's it.
He's
But
like, "What are you talking about now?"
yeah. But you know what? He always comes around, and this is such a side note, but I've learned for many years of, like, I no longer preach and explain things. I just lead by example, and then a few months later, he's like, "Oh, I wanna try that." Like, "Oh, yeah, let's get a sauna." I'm like, "Great. Let's
That
do it."
that's very
Perfect.
very cool. You
Yeah.
figured it out. You figured it
Yeah.
out. You
Yeah.
figured
Yeah.
it out.
I wanna bring this back to women who are 20s, 30s, early 40s, with in terms of heart disease and heart health in general,
Yeah.
what are early warning signs of like, hey, you might have an issue that might be a bigger issue coming down the pipeline? Like, let's kind of start to work on this now, other than just doing tests. Like, what are the warning signs that women can look for?
Yeah, so I think in women, and I think we know this, and this has been well described. Obviously, heart disease presents much different in women, right? And that presentation is very vague. Okay, and I've learned that in my first few years of, I mean, cardiology. It's symptoms like, hey, I'm just tired, or my shoulder, my back is hurting, or I have some nausea. It's not the classic I have chest pain, pressure, I'm having more shortness of breath that we are taught in medical school as the symptoms of heart disease. And so I think that you have to be very careful. I mean, if you're feeling like you're just slowing down and you're more fatigued, and I know this is, I mean, it's a very vague, it's so vague because so much stuff can cause fatigue. But
Yeah.
you have to consider, particularly if you have other risk factors, strong family history, if you've been a smoker, if you so you need to think about it with simple things like just being more fatigued. Again, that nausea type symptom. So that's when I would start thinking about, okay, is my heart okay? And then when it comes to risk factors and kind of being, and you said not really talking about labs. I think that let me think about other things. I wanted to go down the avenue of the lab road for a second, but let me go back to kind of staying away from labs right now. That
It's
those are the
interesting though. Yeah.
yeah. Go ahead.
I was just gonna say it's interesting though that you've noticed that it's more vague in women. Like why would it present more
Yeah,
vaguely?
and that's really a big question. I don't really know, but that's well. I mean, if you look up heart disease in women, that's kind of well described now. Exactly
Wow.
why it is the symptoms are different. I don't know. I really don't know. But they
Hmm.
are clear. They typically, now, don't get me wrong, they can have typical symptoms, but oftentimes the symptoms are not typical. It's the back pain. It's the,
Mm.
again, I just feel more tired type thing. And nausea. Nausea is a very common complaint of women that can have heart issues that not necessarily in men so much.
Right. Okay. And then if we do our labs and we get tested, what does that present as?
Well, one of the things I want to make a very strong statement about is that we actually have been taught that, the cholesterol is the end all be all number that we're looking for as to what causes heart disease.
Yeah.
And so we're taught that the cholesterol should be less than 200, and if it's above 200, your cholesterol is bad, and we need to be thinking about medications and things like that. Well, at the end of the day, cholesterol by itself does not cause heart disease, and there are lots of different types of cholesterol. And I don't even mean the good and bad cholesterol that most people know about. I don't mean LDL and HDL
Hmm.
because
Yeah.
LDL is considered bad cholesterol, and HDL is considered good cholesterol, but not all LDL is bad cholesterol and not all HDL is good cholesterol, right? And
Hmm.
so we take that even further into the LDL particle sizes. Okay. LDL comes in different sizes of particles, and these small particles are much more atherogenic, much more likely to cause heart disease than these large, fluffy, more buoyant particles. The HDL particles, not all HDL is good. The larger HDL particles are good cholesterol, and we call it good because HDL is responsible for a process called reverse cholesterol transport. It actually takes cholesterol out of the body, out of the arteries. And so when we have large HDL molecules, they are responsible for helping to take cholesterol out of the body, helping prevent plaque buildup in those arteries. But more importantly, I'm going to go back to our comment about oxidative stress and inflammation. Heart disease is an inflammatory process, right? And so one of the main things that needs to be evaluated is there any evidence of vascular inflammation? Okay. And there are specific markers. One in particular is a marker called lipoprotein phospholipase A2, LPPLA2. That's a
Mhm.
very specific vascular inflammation marker. And in people who have ongoing vascular disease, the LPPLA2 is often elevated. And so when I talk about a real assessment from a biomarker perspective to assess risk, we want to
Yeah.
look at inflammation markers. We want to look at the cholesterol panel. It's called an advanced lipid panel, where we're looking at the particle numbers and particle sizes, and includes that LP little a that we just talked about as a major risk factor. So that's a much better risk assessment than just getting your typical cholesterol panel that looks at your cholesterol, LDL, HDL, and triglycerides. Okay.
Yeah.
And in fact, I tell people now, looking at those, just a regular lipid panel doesn't really give me really any much insight anymore. Okay.
Right.
So I truly believe that the advanced lipid panel is what we should be looking at to really assess that risk. Um, Now, we do have technology these days too that really has changed the game. There's imaging of the heart called Clearly. Clearly is an imaging modality where we do a CT angio CAT scan that will allow us to look at the heart. And then there is an AI overlay that allows us to kind of look into those arteries and see, is there a 20% blockage or a 90% blockage? And
Uh-huh.
not only if it's a 20 or 90% blockage, what type of blockage is it, right? Is it a calcified blockage versus a soft plaque versus something they call a low density plaque? Because the risk of each of those different types of plaque are entirely different, right? A calcified plaque is more stable than a soft plaque, which is more stable than a low density thrombogenic plaque. Thrombogenic meaning clot forming sticky plaque. Okay. So we've now come to a place in the cardiovascular realm that the assessment for vascular disease or coronary disease is entirely different, man. Like in the past, we do stress testing, and stress tests are designed to pick up blockages of 70% or more. What I tell all my clients is, I don't really want to know if I if I have a blockage of 70% or more. If I have a 30% blockage, a 20% blockage, wouldn't you want to know that early so that I could figure out what I need to do to prevent that 20% or 30% blockage from progressing to 70 or 80%? And moreover, it doesn't take a 70 or 80% blockage to have a heart attack. In fact, most heart attacks occur on blockages of 20, 30, 40% because those are vulnerable plaques. Those are plaques that have more of that low density, that
Wow.
thrombogenic plaque. So if I have a plaque of 40% and it's thrombogenic and low density, that's an issue. And we need to figure out, what do we need to do about that? What's causing me to have this vascular inflammation with this thrombogenic plaque? And so that is where you really see risk early on. A stress test wouldn't pick that up, right? I had a 40 or 30 blockage. I do a stress test. Stress test is great. I send me off. My cardiologist told me everything's good. Have a heart attack 2 weeks from now, right? So now we have the ability to look at the vessels in a much different way.
Yeah. Wow. What are you seeing in terms of rates of heart disease, heart attacks, like issues in your practice? And I guess what I'm getting at is, are the people younger and younger who are dealing with this?
Yeah, I would certainly say we're seeing much more early heart disease these days. We're seeing much more uncontrolled hypertension at earlier ages these days. We're seeing much more, and it will go back to the whole metabolic syndrome, right? We're seeing kind
Yeah.
of the diabetes, pre-diabetes, and there are many, many, many factors that are really likely contributing to this. We've touched on a few of them already. Um,
Yeah.
I think lifestyle is a huge part of it. I think the toxin exposure is a huge part of it. I think that COVID has been a huge part of it too. I'll be honest with you. Things changed after COVID from a heart disease and vascular disease perspective. I see so
Oh,
many more people with uncontrolled blood pressure issues. And to the point where, I have a device in my office that measures your vascular compliance, the stretchability of the arteries. And the more non-compliant an artery is, the higher the blood pressure. So our vessels are typically more stretchy when we're younger. Okay, and then as we get older, those vessels become less uh, compliant, and the blood pressure goes up, and that's largely because of that endothelial dysfunction and nitric oxide levels going down. So nitric oxide actually controls some of that stretchability and the dilation of the arteries. But we're seeing a lot more hypertension, and I think that some of it is because we know that we talked about it already. Spike protein is damaging the endothelium, and so now these vessels are becoming stiffer, and blood pressure is uncontrolled.
Mm.
And very early during 2021, after COVID, I brought this device in so I could measure vascular compliance. We saw that was an issue, and so now we use a lot of nitric oxide products, a lot of the glycocalyx products to help get people off of medications because it's an endothelial problem. It's a glycocalyx problem. And so, and we know that hypertension then is driving the other risk of blockages in the arteries just from having hypertension as a risk factor. So definitely seeing people younger and younger. It's multifactorial, I think. We need to watch what we're putting on the end of our fork. That's a large part of it as well. I'm
Yeah.
not going to mince words with it. It is what it is.
Yeah.
It's pretty bad.
When you mentioned COVID, I mean, I have to ask, do you think it's the COVID or do you think it's the vaccines or do you think it's a combo of both? And like, can we even separate that information?
I think it's very hard to separate, and I think it's a combination of both. I think spike protein damages the vascular wall, and spike protein comes from COVID vaccine. Spike protein comes from COVID itself. I can't tell you that I know that one's worse than the other, but I can tell you that I think, and if you were just to Google spike protein and glycocalyx, there will be 12, 13 pages. I do this in for my clients just to when I'm explaining this. There's probably 13, 15 pages of data and studies now that show the damage to the glycocalyx with spike protein.
Wow. Wow.
So we have to improve the endothelium and glycocalyx. It is, I mean, if we made that a focus, I think that we'd make some inroads to the improvement in cardiovascular disease. It is really one of my big things. Once we start to learn more about this glycocalyx, we need to get better technology to assess the glycocalyx and assess what our therapies are doing, which therapies are working and not working, and
Mm.
improving the regeneration of the glycocalyx. There's a couple of technologies out there to do that now. I think we just need we need better modalities to assess that. But we should be focused on that endothelial health.
And when you say younger and younger, like what numbers, what ages are you actually talking about here?
Even in their 20s, I mean, 20s, late 20s, 30s, and certainly people having heart attacks in their 40s, a lot more than we would see, in the past, a lot more than we'd see in the past.
And
Uh,
both like women and men.
both women and men, I think, I know we should have this conversation. I think one of the things we really and it's a good segue right now. We talked about vascular compliance. One of the reasons women typically develop heart disease much later than men, right? And that's because they have this
Hmm.
protective factor called estrogen, right? Estrogen actually helps the vessels maintain that compliance, right? And
Right.
so once women start to go through perimenopause, menopause, and estrogen levels are very low or non-existent, now all of a sudden I have these stiff, non-compliant vessels again, and the women's rates of heart disease escalate tremendously. Okay, once going through menopause, because it's that protective component of the estrogen. So that's a really, really important factor with respect to kind of the difference between when women and men typically start to experience heart disease, heart attacks, heart disease type symptoms.
Right. But women can start to do things like bioidentical hormones
Yes,
at that
absolutely.
time.
Absolutely. And that's why it's important to understand all the other risks that are entailed. So when we talk about, hormone replacement therapy, it's a lot more than just the replacing the estrogen for, estrogen has so many other roles.
Yeah.
And so understanding what those roles are, i.e. in cardiovascular health, it's important to consider balancing those hormones when they start to go through, those times during perimenopause.
Yeah, absolutely. You know what I actually did? I don't know what you're gonna think about this, but um I had my placenta encapsulated and she
Mhm.
also made tinctures for me to use one day during perimenopause and menopause to help with the transition. And because
Wow.
obviously it has all the hormones and everything in that. And so they're literally in my pantry. My husband thinks it's hilarious. He's like, "You're planning so far ahead for your health."
Yeah.
Um,
How is it stored? How, I mean, is it stored and is it going to be? How is that going to be used 20 years down the road?
yeah, exactly. So it's like I didn't do it. It was done by like this professional who does it, but it's
Uh-huh.
mixed with alcohol and it's like fermented with alcohol, sealed, closed in a dark space. And apparently that's what some women have done. And even like women are able to take like what's it called? Like I'm forgetting the actual name for it, but you can actually get placentas from other people
Yeah. Yeah. Yeah.
and
Yeah.
take it. But I mean, I'm just saying I just think it's interesting to like think about hormones and like if I could take my own hormones from my placenta that have been like, distilled down, I'm
Yeah.
gonna obviously try that and see what it does. I don't know.
If you can, definitely, if you can save those and those can be preserved until it's time to use, that's an amazing concept, actually.
Yeah, exactly.
Uh, Amazing, really amazing concept. Almost similar to there are also lots of stem cells in those type of placenta as well. So how that's preserved would be very interesting to me. That'd be super cool.
Mhm, mhm. Yeah, I looked at doing my stem cells. It's a conversation for another time. Don't have a lot of access to that type of thing in Canada yet, but it would be cool in the future for sure. Um, One final question for you. To all the women listening, what is one thing that you would love them to remember taking away from this episode?
I think we started the whole conversation off with this. I mean, I'm very biased these days. I would encourage everybody that's listening to do that environmental toxin test because I think as you talk about biohacking, we talk about longevity, and we just talk about your overall health as you move forward. There are lots. I mean, there are a lot of people suffering from many chronic illnesses. I mean, all these autoimmune conditions. Again, the heart disease that we talked about, cancer. I mean, that's the other thing we didn't talk about as far as the number of people who are younger who are getting cancer. And a lot of these things are driven by the toxic burden that we're exposed
Mhm.
to. And so, if I could do one thing for every podcast I do these days, or every lecture I give, I would encourage people to know what's going on in your body because you can there's so many supplements and biohacks and stuff that you can do, but if you don't really address that root that's causing the inflammation and oxidative stress, and again, your mitochondria not to work normally, then we can do all these other things that will help. But the underlying problem that keeps breaking things is still there, right? And so that is actually what I would encourage people to do, just because I've seen so much of it. I mean, I didn't go out, I didn't this it fell on in my lap to kind of start to see these type things happening with people and then seeing people get better. And then when you start to order the tests over and over and over again, it became crystal clear that it's a major problem.
Yeah, well, I am definitely gonna be ordering those tests because I need to know. I'm so curious. Um, Thank you so much for this interview. This was very eye-opening, and I think my audience is gonna get a lot out of it. If they want to order the tests and connect with you and maybe even work with you, where can
Yeah.
they do that?
Actually, you can just check out my website. It's Reveal Vitality, www.revealvitality.com. And even on the website, I think there is a store there that if you want to get the Vibrant Total Toxin Test, you can just order the Total Toxin Test from the website. They will send the urine kit to you. You do your sauna like I told you to, send it in, and then we will set up an appointment to kind of go through the results of that with you. www.revealvitality.com. Check out our site. We have a very unique site. I have a longevity center. I think you'll like. I want you to take a look at our site to look at all the biohacking stuff we have here. Um, and we can potentially talk some of these other topics, hyperbaric and cryo and all these other things, how those modalities improve lots of, I mean, cardiovascular health, neurocognitive health. We didn't talk about neurocognitive health at all. Obviously, this is a cardiovascular thing, but I mean, just so many benefits from all these technologies.
Yeah, awesome. Oh, that's so cool that you have that. I wanna come visit, and I wanna try all of it.
Well,
Um,
invitations open whenever you want to go. You come, let me know.
yeah, yeah. Awesome. I will link all of that in the show notes and on my website so everyone can find you easily. Thank you so much for coming on the show. This was great.
Absolutely, my pleasure. Good talking to you.
Thank you for listening to Biohacking with Brittany. I hope today's conversation gave you something to take into your own life, a practice, a perspective, or simply a reminder to trust your body. If you love this episode, please leave a review, share it with someone else who could benefit, and join me over on Instagram at biohackingbrittany for more. And if you're ready to go deeper, you can explore my retreats, community, favorite tools, all linked for you in the show notes. Until next time, remember, your body already knows.